Did you know you have 4 teeth in your mouth that are so important they're literally called the cornerstones of your smile? Well, today we're going to dig in and find out exactly why your canine teeth are the true unsung heroes of your dental arch.
So you've probably heard that nickname before, the cornerstones of your smile. It sounds cool, right? But what are they actually holding up? What makes these 4 specific teeth so absolutely critical to the entire structure and function of your mouth? Let's break down what makes them so special.
Okay, so you have 4 of them. Their technical name is cuspids. You've got 2 on the top arch, that's your maxilla, and 2 on the bottom, the mandible. And look at their position. They're perfectly placed right at the corners of your mouth, sitting between the flat incisors at the front and the wider premolars in the back.
Their main job? It's all about force. I mean, look at that sharp, kind of spear-like shape. They are perfectly designed for gripping and tearing food. You can think of them as the anchors that do all the heavy lifting before your other teeth even get a chance.
So what gives them this incredible strength? Well, it all comes down to the foundation. Canine teeth have the single longest and strongest roots of any tooth in your mouth. And this is the real reason they're called cornerstones. Their deep, incredibly stable roots anchor them into the jawbone, which provides just immense stability to the whole dental arch.
But here's the thing, not all canines are created equal. To really get why they're so strong, we need to look at the upper and lower canines separately because they have some really key differences. Let's start at the top with the maxillary canine, and you'll see what I mean.
All right, we're looking at what's called the labial surface. That's just a fancy dental term for the front of the tooth, the part you see when you smile. And the very first thing you probably notice is that single sharp point. That's called the cusp. That's the business end of the tooth right there.
But that surface isn't just one smooth piece of enamel. It's actually formed from 3 different vertical lobes that all fused together as the tooth developed. Think of them like 3 little hills. You've got the mesial lobe, which is toward the front of your mouth, the distal toward the back, and a big, well-developed central lobe running right down the middle, separated by these faint little grooves. And remember that incredibly long single root we talked about? Well, it makes the maxillary canine the longest tooth in the entire human mouth, from the very tip of the root to the top of the cusp. And that amazing length is the secret to its stability. It's so stable, in fact, it's often one of the very last teeth to be lost to gum disease.
Now, if we could flip this tooth around and look at the back, or the lingual surface, we'd see this feature called the cingulum. It's basically a noticeable bulge of enamel right near the gum line. On these upper canines, the cingulum is really well developed, and it adds to the tooth's overall bulky and powerful shape.
Okay, let's head down to the lower jaw now. The mandibular canine, well, it tells a slightly different story. It's less about that raw bulk and a lot more about being sleek and smooth.
You can see the difference in proportions right away, can't you? While the upper canine is all wide and powerful, the crown of the lower canine, that's the visible part, is usually longer and narrower. It just has a more slender look to it.
And that sleekness extends to the whole surface. Remember how the maxillary canine had all those defined lobes and ridges? Well, the mandibular canine is much, much smoother. Its features, like that cingulum on the back, are way less pronounced. It's almost like a more streamlined version of its upper body.
But the mandibular canine has one more little secret. Here's where it gets interesting. While it's famous for that single long root, sometimes the developmental grooves running down its root are so deep that the root actually bifurcates or splits into 2 separate roots. It's a pretty fascinating anatomical variation.
So we've looked at them one by one, but the real test is being able to tell them apart, right? Let's put them side by side for a quick guide on how to distinguish a maxillary canine from a mandibular canine.
This chart breaks it down perfectly. So first, crown shape. The upper is bulky and wide for that maximum tearing force, while the lower is longer and narrower, designed to work right inside that upper arch. The surface follows the exact same pattern, super defined and ridged on top, much smoother on the bottom. Even that cingulum, the bulge on the back, is way bigger on the upper canine. And here's a key detail. The upper canine often has this little notch where the enamel of the crown meets the root, which you just won't find on the lower one.
And here you can really see that difference side by side. On the left, you've got the powerful, bulky maxillary canine, and on the right, the sleeker, smoother mandibular canine. The contrast is just so obvious once you know what you're looking for.
So let's wrap this all up. Your canines are the cornerstones of your smile, and they're specifically designed for gripping and tearing. The upper, or maxillary canine, does this with sheer bulk and the longest root in your entire mouth. The lower, or mandibular, is its sleeker partner, built to be narrower and smoother.
but together their super deep roots provide the critical stability that supports your whole dental arch.
And that strength isn't just for eating. As the source material points out, canines are so strong that in dentistry they're often used as the main anchors to support and hold on to prosthetics, like bridges or dentures. They really are foundational.
And that kind of brings us to a final thought. Now that you understand the deep roots, the unique shape, and the huge structural importance of these teeth, it becomes pretty clear, doesn't it? Losing a canine isn't just about having a gap in your smile. It's about losing a fundamental pillar of your entire mouth.